You also give a distinction between capital T, big T, little t trauma, because a lot of people are familiarized with the overt, big, cataclysmic events that happen in people's childhood or in life. But can you give that distinction? I think so.
Well, the distinction really is how the trauma is sustained. So the capital T are the ones easy to recognize. So there's the very famous, not famous enough, but very famous adverse childhood experiences studies, the ACE studies that were done here in California with 17,000 adults. And what they looked at is certain experiences in childhood, what they call adverse childhood experiences, and adult outcomes. So an adverse childhood experience was physical, sexual, or emotional abuse. That's 3. Neglect, a parent dying, a parent being jailed, a parent being mentally ill, a parent being addicted, violence in the family, a divorce. 10. And you get a point for each. Now, the more points you accrue, the greater the outcome in adulthood. So, for example, with addiction, a male child with 6 of these, their risk of addiction doesn't go up 6-fold, it goes up 46-fold. So that these multiply each other. So these are the adverse childhood experiences, very famous, not famous enough, I can talk about that, but famous. These are the big T traumas, things that you can identify. More confusing and more difficult to reckon with are what some people, including myself, call the small T trauma, which isn't the bad things that happened, but the good things that didn't happen that should have. So children are born with certain needs. Now it's clear to you that if I don't feed an infant, they're going to be hurt. I'm not doing anything to them, but I'm also not giving them what they need. Human children and human infants, human beings also have certain emotional needs, and depriving them of those needs is traumatizing. So a child not getting the attention they need, the love they need, the acceptance they need, being seen, being heard, being given the freedom to experience all their emotions, whatever they happen to be. Certain other needs, if they're not met, they're also wounded. And that's what I call the small T traumas. These little things that when you ask people, by the way, we can do this experiment here in this room if there's anybody brave enough. I had this really happy childhood. And then but I still got addicted, or I had autoimmune disease, or I had depression, or I had malignancy, or I had anxiety, or I have ADHD. But I had a happy childhood, and then I issue what I call the Happy Childhood Challenge, which is give me 3 minutes, and we'll see how. So if there's anybody here that had a really happy childhood, they want to find out just how miserable it really was. Feel free to volunteer. It's always a learning experience. So anyway, that's the small T of the needs not being met.
Yeah, I think that's such a powerful distinction, because oftentimes we're not aware of what we didn't get, like the nutrients we didn't get as a kid, but that ultimately contributes to the constitution that we develop.